Latinos are a dynamic, diverse, rising population. We are the minority majority in the United States. Within a few decades, 1 in 4 people will be Latino. But cancer threatens the future health of our population. Sabia Usted? Cancer is the #1 cause of death for Latinos. Latino cancer cases are expected to rise 142% in coming years. Latinos suffer 2 times higher rates of liver and stomach cancers than white people. Only 66% of prostate cancers in Latino men are diagnosed at a local stage versus 72% in white people. Latinas are 40% more likely to be diagnosed with cervical cancer than white women. Only 59% of breast cancers in Latinas are diagnosed at a local stage versus 67% in white people. Fewer Latinas have mammogram screenings for breast cancer at 61% than their white peers at 65%. Latinos are less than 10% in NCI clinical trials and less than 4% in FDA drug trials. Latino cancer health disparities are driven by structural inequities that have been built into governmental laws, economic policies, school systems, neighborhoods, businesses, research, and healthcare. Sabia Usted? 1 in 3 U.S. Latino families live in poverty. 15.1% of Latinos have no health coverage, the highest among racial/ethnic groups. Latinos who are housing cost burden rose from 42.4% to 56.9% recently. Latino neighborhoods have 1/3 as many supermarkets as non-Latino ones. Only 1 in 3 Latinos live within walking distance of a park. 27% of Latinos rely on public transit daily and weekly versus 14% of white people. 44% of Latinos live with poor air quality. 42% of Latino kids live in childcare deserts. Only 40% of Latinos participate in preschool. 78% of Latino kids suffer at least one adverse childhood experience, such as poverty, abuse, or neglect. 28% suffer more than 4 ACEs. Anti-immigrant rhetoric, implicit and explicit bias, lack of social cohesion, all harm Latino health. Latinos are dying from COVID at 2 times the rate of their peers. The pipeline of Latino healthcare workers does not reflect national population demographics. Sabia Usted? Only 5.7% of nurses are Latino, yet 73.5% are white. Only 6.3% of physicians are Latino, yet 67% are white. Only 6.9% of medical school matriculants in 2020 through 2021 were Latino. Latinos comprise 2% of hospital leadership and 4% of medical school leadership. We need researchers, physicians, healthcare professionals, patient advocates, and students from across the nation to unite to create research advancements, change systems, and take action to address health inequities and their resulting cancer disparities. We need a renewed pipeline of Latino healthcare providers with increased access to education and educational attainment. Together, we can translate basic research into clinical best practices, effective community interventions, and professional training programs to eliminate cancer disparities in Latinos and save lives. Ahora, ya saben,